All right, so some of the questions we get are, do we take x-rays, or why do we take x-rays? And it's really simple. To see is to know, not to see is to guess. So if you've had chronic pain, or maybe you got neurological symptoms, headaches, or things that just have not resolved, we need to know exactly what's going on, and we need to be able to see inside to know, is there damage in the joints, is there degeneration, is there something that we need to know about that might be a contraindication to care? And ultimately, how do we know exactly how to take care of you? What kind of adjustment do you need specifically for your particular spine, for your precise misalignment? And then also, based on what we see on the inside, is what kind of exercises might you need to be doing at home? So that's how we take x-rays, really simple. We are one of, I believe, 3 offices in the entire state that utilize CBCT, that's cone beam CAT scan. Same technology they use at the dental offices, but it's modified to look at your cervical spine, and more specifically to analyze your upper cervical or craniocervical junction. Okay, so that's what this looks like. We get a 3D image and we can just rotate it around. It's pretty cool / kind of creepy, but really neat. We can look all around, and what we're going to do actually is look at slices. So for example, that's an atlas underneath the skull. We can look at the joints this way. So we can look at every angle and slice to figure out exactly where the misalignment is and precisely how to correct it. So in our office, when you have a misalignment here, your anatomy, my anatomy, and everyone's anatomy is slightly different. So your degrees and angles will be different. So we actually tailor an adjustment that's specific to you based on your anatomy and your misalignment. We also take x-rays so that we can see pre and post. In other words, you got your first x-ray and it's going to show where the problems are. And then down the road, we'll take a follow-up x-ray and we can see that you're actually improving. Obviously, we're not going to x-ray if you're pregnant, unless it's an extreme emergency. And generally, small children, we're not going to x-ray as well because their joints haven't fully developed yet. Again, unless it's an emergency. In which case, you're probably not going to be here. You're going to be in the emergency room. But thanks for tuning in. Hope that answers your question. If you have any more questions about why we take x-rays, don't hesitate to give us a call at Mount Dora Family Chiropractic. God bless.